This 8-minute video was created with the goal of achieving a high score in your exams.
Certain types of prostate cancer are influenced by hormones such as androgen. These cancers have receptors that bind to androgen, promoting their growth. Treatments that prevent these hormones from attaching to the receptors are known as hormone or endocrine therapy.
Question: how would you prevent the growth of prostate cancer? Please list 4 ways to block this pathway.
The first method is to block the androgen receptors. The second method is to inhibit the synthesis of androgen. The third method is to inhibit the secretion of androgen. Androgen is produced in the testes.
Question: which cells secrete testosterone?
Leydig cells are the primary source of testosterone or androgens in males. The production of androgens is regulated by the hypothalamus-pituitary-gonadal axis. The hypothalamus releases luteinizing hormone-releasing hormone, also called gonadotropin-releasing hormone, which then binds to receptors in the anterior pituitary gland. This binding triggers the synthesis and release of both luteinizing hormone, LH, and follicle-stimulating hormone, FSH. By blocking the receptors in the anterior pituitary gland and controlling the commands from upstream, we suppress the secretion of androgen.
Question: are androgens produced only in the testes?
Androgens are also produced in the adrenal glands. And in this case, they can be managed by blocking the receptors or inhibiting androgen synthesis.
Now, let's take a closer look at each pathway.
The first target is the androgen receptor. Flutamide and bicalutamide are nonsteroidal antiandrogens that work by competitively binding to the intracellular androgen receptor, thereby blocking the effects of androgens. The notable side effect is gynecomastia. Abiraterone and ketoconazole are inhibitors of androgen biosynthesis, effectively blocking CYP17.
Question: what is CYP17?
It's a good opportunity to review androgen synthesis. The major androgen in male is number 1, dihydroepiandrosterone, number 2, androstenedione, and number 3, testosterone.
Question: what are the 3 major androgens in male?
The major androgen in male is number 1, dihydroepiandrosterone, number 2, androstenedione, and number 3, testosterone. D. A. T. DAT.
Dihydrotestosterone is an androgen hormone responsible for promoting the development of male characteristics. It is synthesized by converting testosterone and androstenedione.
Cytochrome P450C17, encoded by the CYP17 gene, is a component of the 17-alpha hydroxylase 17-20-lyase enzyme complex. They are necessary for synthesizing androgens from progesterone and pregnenolone. Abiraterone and ketoconazole are inhibitors of androgen biosynthesis, effectively blocking CYP17. The notable side effect of abiraterone is hypertension and hypokalemia.
Question: why does abiraterone cause hypertension and hypokalemia?
This pathway is frequently tested, so let's practice recalling it regularly. Abiraterone is a pregnenolone analog that inhibits CYP17A1, preventing the formation of DHEA and androstenedione. As a consequence of increased mineralocorticoid levels, hypertension as well as hypokalemia and fluid retention may be caused by abiraterone. The notable side effect of abiraterone is hypertension and hypokalemia. A similar side effect has been reported with ketoconazole. The notable side effect of ketoconazole is gynecomastia. The next target is the LHRH receptors. The hypothalamus releases luteinizing hormone-releasing hormone, also called gonadotropin-releasing hormone, which then binds to receptors in the anterior pituitary gland. This binding triggers the synthesis and release of both luteinizing hormone, LH, and follicle-stimulating hormone, FSH. A LHRH antagonist is used to block the LHRH receptors in the anterior pituitary gland. Degarelix is a third-generation LHRH receptor antagonist. It competitively and reversibly binds to LHRH receptors in the pituitary gland, leading to an immediate suppression of LH and FSH release. This rapid suppression results in a quick decrease in testosterone secretion by testicular Leydig cells. The notable side effect is hot flashes. Attention is also needed for liver function impairment. 4. Control androgen secretion. The medication used for this treatment is an LHRH agonist, which means that this drug mimics the action of LHRH. It binds to LHRH receptors in the anterior pituitary gland, resulting in the production of LH and FSH.
Wait a minute. Doesn't LHRH agonist stimulate androgen secretion?
That's right, LHRH stimulates androgen secretion. However, there is a key point in this treatment, which is to administer it repeatedly. Continuous treatment with LHRH agonists causes a decrease in the number of LHRH receptors and an uncoupling of the LHRH signal transduction mechanism. This results in a desensitization of gonadotrophs and a marked reduction in the secretion of bioactive LH and FSH. LHRH agonists are a well-established treatment for sex steroid-dependent cancers such as prostatic cancer and breast cancer. Commonly used medications include goserelin and leuprolide. LHRH stands for gonadotropin-releasing hormone or luteinizing hormone-releasing hormone. So, you can remember the names of medications by their initials. In the case of LHRH agonists, it is necessary to be cautious of testosterone flares.
Question. What is testosterone flares?
When patients receive an LHRH agonist for the first time, they may encounter a phenomenon known as testosterone flare. This transient rise in testosterone levels happens because LHRH agonists briefly stimulate the pituitary gland to release extra luteinizing hormone before blocking its production. This flare-up can exacerbate clinical symptoms like bone pain, ureter or bladder outlet obstruction, and spinal cord compression. To mitigate this increase in testosterone, another form of hormone therapy called antiandrogen therapy is typically administered alongside the LHRH agonist during the initial weeks of treatment.
Question. Does treatment with LHRH antagonists cause testosterone flare?
Unlike LHRH agonists, LHRH antagonists do not cause a testosterone flare, because LHRH antagonists don't increase testosterone secretion in the testes.
Thank you for watching. If you liked the video, please hit the like button. If you want to see more videos, hit the subscribe button.